Will COVID-19 cases decrease before 2021? The end of 2019 saw a new type of pandemic outbreak called COVID-19, or the novel coronavirus, a deadly disease that left millions of people around the world sick with flu-like symptoms such as fever, cough, shortness of breath, and more. First diagnosed in Wuhan, China, the virus has spread and affected people in many countries around the world, with the WHO declaring it as a pandemic condition. As the virus continues to spread ruthlessly around the world, one of the most frequently asked questions, with about 34,900,000 Google search results, is, will COVID-19 cases decrease before 2021? If you're watching this video, chances are you might be having the same question on your mind. Well, before we bring it to our thoughts, make sure you watch this video to the end, hit the red button to subscribe, and hit the bell button to get notified of our new videos. Now, if you've been marking the pandemic by the pileup of cautious reopenings and rescheduled events around the world, you might think an end to this global outbreak is in sight. An event planner for the Kentucky Derby in Bonnaroo, for example, already have new opening days on the books in September, and the Olympics are scheduled to start in Tokyo on July 23, 2021. There's just one problem. When exactly will the pandemic be over? Will there be a decrease in infection cases come 2021? Well, the answer to that question depends on a whole number of factors that I'll share with you in just a few minutes. But first, you must note that the virus is an unknown player, and the best minds on Earth can't do more than make educated guesses about what comes next and when. Just as no one noticed the blood clot situation in COVID-19 patients until recently. And according to a recent briefing document produced by the Public Health England, as seen on The Guardian, the COVID-19 outbreak is expected to last around 1 year until spring 2021, with around 80% of the population infected and up to 15% of people, 7.9 million, requiring hospitalization in the UK. But amid these findings, is there a way COVID-19 could possibly decrease in 2021? Several unknown factors will influence the trajectory of the pandemic, but the major drivers fall into these categories. 1. The virus itself. One of the vital drivers in seeing a decrease in the coronavirus pandemic in 2021 is the duration of COVID-19 immunity. This refers to the amount of time a person maintains immunity to SARS-CoV-2 after recovering from the infection. At present, there is a little-known fact in this area as more research is required. If a person can maintain immunity for a prolonged period, say 12 to 24 months after recovery, they could safely return to public spaces even as the virus circulates. This implies that the populations could reach herd immunity, making it more difficult for the virus to find a susceptible host. But if the immunity is short-lived, a person who has been infected will soon become reinfected again. 2. Seasonality. Studies show that the coronavirus family tends to peak in winter months and wane in warmer and more humid weather. But SARS and MERS do not have seasonal variations, and at this point it's still unclear whether COVID-19 transmission will slow during the summer and fall of 2020. The high transmissibility and extreme speed of this virus mean it's very likely to circulate the globe quickly and unimpeded. But if we're lucky and SARS-CoV-2 proves to be seasonal, we could use that temporary pause to stockpile medical supplies and build up our testing and laboratory capacities, strengthening our defenses against the successive waves of COVID-19 come winter 2021. 3. Viral mutation. As all viruses mutate to some degree, subsequent SARS-CoV-2 mutations could have several divergent outcomes, as experts believe the SARS-CoV-2 is relatively stable and less prone to regular and rapid mutations. It might mutate and die out as it happened with SARS and MERS, or might mutate in response to effective therapeutics, making it more resistant and potentially more persistent and severe. Mutations could also shorten the duration of immunity, as is the case with seasonal influenza. However, much more research is required to confirm this. If true, this would mean that immunity could be more predictable and long-lasting. 4. Adhering to safety measures. The first large set of government tools in stopping the spread of the virus are social distancing measures, including school closures, telework requirements for all non-essential businesses, bans of gatherings of groups larger than 10, and self-isolations. These are the only existing mechanisms to stop the spread of the virus. If social distancing measures were implemented with maximum aggressiveness for 8 to 10 weeks, as seen in China, they could significantly break transmission and slow the spread of the virus, buying the country time to stock hospitals with key medical supplies, e.g. personal protective equipment, PPE, ventilators, intensive care unit beds. This would prevent hospitals from being overwhelmed, which would improve health outcomes and lower fatality rates, ultimately flattening the curve and extending the timeline for the outbreak. However, this would require unprecedented levels of coercion that would likely stir opposition. 5. Testing capacity. An ideal COVID-19 test would provide results in minutes rather than days and would minimize exposure to healthcare workers. Countries like Singapore, South Korea, Taiwan, and Hong Kong have managed to control their epidemics through early and highly aggressive testing, contact tracing, isolation, and quarantine without imposing harsh social distancing requirements. 6. Safe vaccine production and distribution. The most crucial technological factor is vaccine production. A safe and effective vaccine is the only intervention that can definitively end the coronavirus pandemic. The earliest a proven vaccine could be distributed is likely the fall of 2021, though recent reports suggest a vaccine might become available in early 2021. It is wholly possible that it'll take much longer than that, even 3, 5, or 10 years, to demonstrate both vaccine efficacy and safety. However, an aggressive effort to expedite vaccine financing, manufacturing, and distribution could shorten the timeline for ending the pandemic. A guess is not comforting when you're dreading another week of monotony in the same four walls. End dates are comforting, reopenings are comforting, and contemplating a future that looks a lot like our cozy, crowded past is way more comforting than our isolated present. But let's not confuse comfort for truth. The COVID-19 pandemic will not be ending anytime soon, but there will be tremendous decrease in its spread come 2021 if all measures like early vaccine production and distribution are in place and safety rules like social distancing and regular hand washing are strictly adhered to. What's your take on this? Let's hear your view in the comments below. And if you enjoyed this video, please smash the like button, subscribe, and share with your friends. Who knows? You may just be helping someone out there.